Hello, everyone. I'm Angela Davis, and you are listening to NPR News. You can't tell this on the radio, but right now I am in beautiful Red Wing, Minnesota at Mandy's Coffee and Cafe with a great group of guests. Aren't you guys a great group? I think you're a great group. We are here because 5 years ago, we wouldn't have been able to. In 2020, at this time, our entire world was shuttered due to COVID-19. Do you remember what that time was like? Yeah, the quiet freeways, standing in line to shop for groceries, hand sanitizer was everywhere, kids were doing school online, hospitals overflowed with the sick, and we know that millions of people around the world died. And all of that fell disproportionately on the shoulders of already disadvantaged Americans. The COVID-19 virus exposed and exploited disparities for Black, Brown, Native, poor, and rural Minnesotans who died at higher numbers than their white and urban neighbors. As a result, healthcare and community leaders promised to renew efforts to help all Minnesotans get access to quality, affordable care. So, 5 years later, we wanted to know, how's that going? We've come to Southeast Minnesota to find out. The work here is tangible. People know each other. If change is going to happen, it has to be sustainable in communities just like this here in Red Wing. So, let's get started with the conversation. Let's meet our experts. First, we have Kristin Johnson. Chris is the Deputy Director of Goodhue County Health and Human Services. And Goodhue County is, of course, home to Red Wing, where we are right now, and Prairie Island Indian Community. Welcome, Chris. Nice to meet you.
Thank you.
Hi, nice to see you. We also have a bastion of Red Wing here. Julie Malyon. Did I say it? Malyon? Yep. Julie Malyon is here. Julie is the Executive Director of CARE Clinic, which is a nonprofit in Red Wing celebrating its 15th anniversary. CARE serves the uninsured and underinsured in Goodhue and neighboring Wabasha counties, and we'll get into what that means in just a few minutes. But thanks for being here, Julie. So nice to meet you.
Thank you.
Yeah, I know you all have stories. You have seen some things, and we want to talk about that. But before we dive in, I really want to set this up appropriately. Minnesota is often recognized as one of the healthiest states in the country, and that is true. But health outcomes and access to resources are not equal. People of color, Native communities, immigrants, refugees, individuals with disabilities, residents of rural areas all face barriers to quality and affordable health care. And for many of those groups, the obstacles are rooted in decades of systemic oppression. And that was before the pandemic. I just want to paint that picture, bleak as it may be, because when COVID-19 came along, all of those inequities were exacerbated, which is when government and health leaders said, okay, let's really do something about it. It is time. So, Chris, I want to start with you. It's been 5 years. Promises were made. Money was spent. Do you think it is actually getting better?
Diving right in. Okay. I'm not sure that I can give you data that says, yes, officially it's getting better. I think that our understanding is getting a lot better. I think that we are getting clearer on where some of the disparities lie, and we're getting clearer on how we address them. So getting connected to our communities, asking better questions, understanding the issues. I can tell you that I think that's getting better.
So we have a better sense. We know exactly what needs to be tackled and maybe how severe, or maybe in some cases not as severe, the problem is?
Exactly might be a lot. But I mean, health is incredibly complicated. Mm-hmm. And so to say that we know exactly what to do to address any one health issue, I mean, there's so many issues that go into every single element. But we do have just better understandings and I think just better tools to be able to address the issue.
And have you found community members, patients, they are also more informed and they may be more aware of some of the inequities that they're facing?
I would say that's very much true. Yes, that there's definitely an increase in awareness of what's out there and the disparities that exist, especially for certain people. Yes.
Has it felt like 5 years has gone by? Or Is it just a blur?
I feel like I've lost my concept of time during COVID. It was, it felt like 50 years. And it also, like, if you think back on, it was this time of year and everything was hushed and quiet. And I can remember what that felt like. But yeah, so much has happened since then that it feels like a long time.
Julie, the care clinic had stepped into the healthcare gap long before the pandemic. You've been around for 15 years. Tell me how the care clinic got started.
Yeah, it's a great story, really a grassroots story. There was a group of health professionals that were kind of associated with one of our churches in town here who went down to the Hurricane Katrina site in Biloxi to provide free care. So kind of set up free clinics in church basements and provide care for the hurricane victims. And one night after a long day of providing this care, they were having dinner together and they said, we traveled all this distance to provide this care, but I bet there's a need locally in our own community. And so when they came back, they were really motivated to investigate that more. So they started inviting people to the table and asking the questions and finding that, yes, there really was a need in our community. And about that same time, there was an administrator who was coming to our local medical center. At the time, it was Fairview, now it's Mayo, who was also doing kind of informal needs assessment and agreed. And so we kind of had their partnership right from the beginning, which was really valuable to have. And so that group started meeting and things were moving forward. But then I think really the catalyst of having things move forward was because there were still some people saying, there's an ER. Like everyone can go to the ER and they can't be turned away. So is there really a need for a nonprofit clinic? But there was a gentleman who was really well known in our community, well respected, had recently lost his wife and was a single dad. And he was starting to have some health concerns, some chest pain, just wasn't feeling well. But he was going through financial hardship and knew he couldn't afford to go to the ER or even the clinic. And so he just thought, I'm just going to tough it out. It'll get better. But unfortunately, he passed away very suddenly, leaving his children orphaned. And I think that was kind of a wake-up call to the people who are still kind of questioning if there was a need for this, recognizing that there are barriers to healthcare. And there's a lot of people who are very responsible, even if they can access the ER, they're not going to if they know that they can't afford it, and especially if they don't have insurance. And so we really decided to move forward at that point. Interestingly, the week that our board voted to become a board and then officially a nonprofit clinic was the same week that the ACA was voted into law. And so we debated that, like, are we even really going to be needed once the ACA is in place? But we knew it was going to take 5 years for that to be fully implemented. So we're like, well, we'll be around for at least 5 years. But every year that we've been open in the last 15 years, we've served more patients, provided more encounters than we had the year before. There's always gaps in the healthcare system, and so we've been flexible and responsive to the community needs to meet those needs. But there's always been more people to serve.
But have you found, Chris, that there are people who just know, like, who just don't even seek out healthcare because there are all these barriers? They know it'll just be too hard, or that they won't be able to afford it, so they don't take care of themselves.
Oh, absolutely. Absolutely. And the people that we serve at Health and Human Services, some of them don't have a healthcare home. Some of them are afraid to go to the doctor. They're afraid that I'm going to go and then I'm going to have this test or that test and I'm not going to be able to afford it. And then plenty of people, wait until there's a crisis and they can't help but go. And then they have to go to the ER and then the bills are astronomical.
Right.
And so then, they're stuck with the bill or, the hospital has to figure out how to help them, manage the bill. And it's not good care for them. They're in crisis at that point. So absolutely.
And Julie, describe, who do you primarily serve at the care clinic?
Yeah. So we serve people who don't have insurance or who are uninsured. And then we've recently expanded our dental clinic. So we're a critical access dental clinic. And so we serve people who have medical assistance or Minnesota Care.
And the fact that you mentioned dental care, we often forget about that. I mean, that's a whole thing. People choosing just not to seek dental care.
Mm-hmm. Yes, absolutely. Bringing it back to the pandemic, we decided to expand our dental clinic in 2020. So literally just as the pandemic was hitting. And at first we thought this is a horrible time to be expanding a service so dramatically like this. But we found that it was so important and so crucial during that time because the dental clinics closed and they were told only care for your established patients. Well, if you don't have a dental home, you had nowhere to go. So there was multiple people who came in with literally life-threatening dental emergencies during those first couple months of the pandemic. I remember one gentleman had just moved here from Colorado and had gotten a job at a local factory. And when he arrived, he was told his job no longer existed because of the pandemic. And at that time, he was forming an abscess that was getting worse and worse. And he called like 30 dental clinics and was turned away from all of them.
Because they don't accept
because
people with no insurance, or because they just didn't have the capacity to take on more patients?
I think partly because they were closed during that time for, patients that weren't their dental home patients, but also just because, yes, they wouldn't take someone without insurance. And so he, finally found us and was so grateful to have that care. He came and we helped him get enrolled on insurance. And then his infection was so bad, it was like almost blocking off his airway. And so we sent him to the ER with that insurance in place. So he had like his abscess drained. He had to spend a couple nights in the hospital having IV antibiotics. And then he eventually came back to us for that dental care to deal with the, no pun intended, but the root cause of, his health problems. So it was hard to be opening and expanding our dental clinic so much during that time, but it was also so crucial for many people.
And, during this time, 5 years later, when we're looking at the height of the pandemic, it's hard for people to look back on some of these memories. Like we've kind of put them on the shelf and you don't want to look back at them. And because have you found that to be true, that folks don't want to remember how bad things got?
Oh, absolutely. I think we're seeing, that part of what Health and Human Services does is we do emergency preparedness. And so we talk about like there's the incident, there's the crisis incident, and then these incidents have a very, very long tail. And so we are going to be dealing with the fallout from the pandemic for years and years and years. And we're still seeing it very much in mental health right now, that people's mental well-being is worse overall, and kind of sticking, that the anxiety, that the trauma of being isolated, and especially, the more vulnerable people that we see, people who lived in poverty, people who have disabilities, people who relied on public transportation, were extraordinarily isolated. And so the trauma of that isolation, literally we've talked to people with serious and persistent mental illnesses they saw, 2 or 3 people in the course of a year. I mean, it was incredibly traumatic, and we'll be dealing with that for a long time.
And we're going to talk more about mental health in a few minutes, but I want to go back to what was happening day to day at the care clinic, and I'm sure you have many vivid memories, Julie. You stayed open. What were the waiting rooms like?
Yeah, the waiting rooms were pretty empty. So because we were trying to keep people safe. So we tried to be as creative as we could with telehealth visits, or even we had drive-up visits. So the doctor would come out to people in their cars.
I forgot about that.
Yeah.
The drive-up visit. Yeah. I don't even know how that worked. But it's better than nothing, right?
Exactly. Yeah, and tried to just do a lot of things through the mail. Then we also were very busy. Like, you were saying it was kind of a quiet time and silent for a lot of people, but I felt like I was almost more busy than ever because we really wanted to get into the vaccinating and providing testing for people, especially because we knew that our population probably didn't have the same access as the rest of the community.
So do you feel, though, now that there's maybe some more trust because some relationships were started and some maybe trust was developed during the height of the pandemic?
Yeah, absolutely. I think trust with our patients and with the community, but also with partners. I mean, that was one thing that really was a positive, and it's good to look for those positives that came out of the pandemic. We had worked together some, but we worked together so much more closely, us and Health and Human Services and us and Mayo Clinic Health System in our community during the pandemic. I don't know if you want us to talk a little bit about like our vaccine efforts together now?
Yeah.
Or?
Well, I remember it forced all of us to do things differently. And I have in my notes here that you all actually set up vaccination clinics at hog farms. Like you went to where
Yeah.
people were.
Absolutely. Yes.
Well, yeah, the care clinic went out so Health and Human Services, we set up vaccination clinics in 3 different sites in Goodhue County. And then as a county agency, we had regular access to vaccine. And so we started collaborating very early with the care clinic and said, do you want us to order extra vaccine that we can then pass on to the care clinic, then you can take to your patients because they know you, they trust you, you are their healthcare home. So that was our regular practice throughout COVID, is collaborating on those vaccination efforts. And that meant that Health and Human Services could offer the 3 vaccination sites, and then the care clinic really kind of did strike teams and went all over the community in providing vaccine.
So having to do things differently, did you find that the pandemic, it changed really how public health works? And maybe you have some few examples of what changed for you in Goodhue County. I have an example here of working with people who don't speak English, and how do you get information to them
Yes.
about like the vaccine? We have it in stock, and this is how you get it, and what it'll do for you.
Right. So we wanted to get the word out to people about our vaccination clinics, and then also just get public health information out in general, why it's beneficial to get vaccinated. And we know that that part of trusting public health information is that you trust the messenger. And so it was really important for us to think about how we get those messages across. So when it was time to reach out to our Spanish-speaking community, we talked internally at Health and Human Services, and we thought, okay, we're going to create posters, and we're going to create them in Spanish, and then we're going to put them up in places where our Hispanic community are most likely to go, like grocery stores and that kind of thing. And we were pretty far down that road of that was going to be our effort in reaching out to their Spanish-speaking population. And then we were reminded that we always want to include the voice of the patient. And so we sat back at Health and Human Services and thought, we think we know, but then best practice is we don't decide for people, we ask them. Mm-hmm. And so we went to one of our partner organizations, which is Hispanic Outreach of Goodhue County, another fabulous organization. And we said, here's our plan, and we're going to do these posters, and they're going to be in Spanish, and we're going to put them up in these places. And they said, yeah, don't do that. They said,
Why not?
Well, first of all, they said, have you ever been compelled to do anything by a poster in a grocery store? Like, people don't even look at those posters. That's fair. And then second of all, they said, we have people who speak Spanish. It doesn't mean they read it. It doesn't mean that vaccine translates. And it doesn't mean that you build trust in a poster. So what they told us is that you need to utilize trusted messengers. They said most of their community is on Facebook, and that they know the care clinic and they know Hispanic Outreach. And so that they suggested that we create a video where our care clinic partners talked about vaccine, why it was safe, and why they encouraged people to get it. It was all in Spanish, and then we posted it on various Facebook sites so that people could get the information directly. When we wouldn't have known that if we wouldn't have asked. And we've gotten better at asking. I think that's one of the things, one of the really important lessons from the pandemic is that we've got to get the voice of the people we're serving in our work.
So that is a great, a good thing that came out of it. It forced all of us to become more creative, to create relationships with people that we didn't know before, to collaborate, to try new things in new ways. And again, the people that you're trying to serve, making sure they have a seat at the table so you're hearing from them what will actually work. I mean, those are huge, valuable lessons. And any other examples at Care Clinic where you were forced to do things differently, but you did it and it had a great outcome?
Yeah. I mean, going on that same line, we did develop a patient advisory council kind of after coming out of the pandemic, and that has been really great.
What does that mean, a patient advisory council?
So we have some of our patients meet on a quarterly basis and just get feedback from them. Sometimes we're using them as ambassadors, so we'll give them information, like with the recent Minnesota Care expansion, giving them knowledge and information and then asking them to go out into the community and kind of spread that. But then we're also wanting input from them on, are there services that you need that we're not offering? Are there things that we could improve, so that they really have input in the clinic and what's going on in the clinic as well. Yeah.
All right. If you're just joining us, we're listening to a North Star Journey live conversation, an event series produced by NPR News that focuses on disparities in Minnesota and people who are working to level the playing field. We're using the 5-year anniversary of the start of the COVID-19 pandemic as an opportunity to revisit healthcare gaps in our state, and we're doing it in Red Wing with two women who are boots on the ground, as they say, when it comes to helping all Minnesotans have access to health care. I'm talking to Julie Malyon, the Executive Director of Care Clinic here in Red Wing, and Kristin Johnson, who is the Deputy Director of Health and Human Services for Goodhue County. And so, Julie and Chris, I found a definition of health equity from the Robert Wood Johnson Foundation, and I want to read it because I think it's a good definition. It says that health equity means that everyone has a fair and just opportunity to be healthier. This requires removing obstacles to health such as poverty, discrimination, and other consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. It's a broader definition than just making sure that there are enough doctors per capita. And it really kind of gets into, sort of these social determinants of health. And so, Chris, when we look at something like housing, what do we know about the relationship between housing and good health care?
Absolutely. Housing is one of those pivotal areas that if people don't have stable housing that they can trust, not much else can happen. And we know that, we've learned that we work with a lot of people directly. And when we try to address other issues with their family and try to support in other areas, it just doesn't work if they don't know where they're going to sleep that night.
Right. How can you focus on anything?
Yes. And so, some places have adopted the housing first model that you've got to start with housing before you can really look at any other issue.
And at the top of the show, I mentioned that Prairie Island Indian community is in Goodhue County, and we did reach out to tribal officials, and no one was available to speak with us. But I know that you've spoken with them, and what are they saying about the work that you've been able to do with them to try to improve access to health care?
Well, we've really strengthened our partnership with the Prairie Island Indian community, and that was starting before the pandemic. The city of Red Wing and Prairie Island had a really nice partnership in working with the land and creating really a shared sense of connection to the land. One of the things I think about when it comes to serving the Prairie Island community and our Dakota neighbors is that we just have such different worldviews. And the more that we have strengthened our relationship, when it comes to things like healthcare, in Minnesota, we have such a medical model about healthcare. And the Prairie Island community, the Dakota people, have such a holistic view of healthcare overall. So we might think of a mental health intervention as therapy. And most people, when they think about mental health, they think about therapy and going to therapy, or they think about medication. And the Dakota people think about health as the total person and the connection to the environment, and that the land is actually like a neighbor. It's like a cousin, it's a family member. And when they're connected to the land, they feel well. And so when they're not connected to the land, they can feel unwell. And so the efforts that the city of Red Wing and the community have made to restore sacred land, like the bluff here, the Himanicha Bluff, restore that and bring in more like native plants and grasses. Our Dakota neighbors have said, this is about my well-being. this is what a land acknowledgement looks like. This is what it's like for me to address my health care. So I used to think that if we're serving people well, that means that we have Native American therapists. And there's a place for that. But what they're saying is that mental health care is walking on the bluff. It's being with elders. It's smudging. It's dancing. It's being in community. And who am I to say that's not a mental health intervention? And so we've just expanded our definition of what true health care and true well-being means. And I think we're so steeped in that medical model. And that's not to say there isn't a strong place for the medical model, but to open our perspectives and say that is one type of health care, and that well-being is so much bigger than that.
And how did you all tackle vaccinations with people at Prairie Island?
Yeah, so we were having regular meetings with the Prairie Island community, and they said that again, the message needed to come from trusted messengers in their community. And we had a really fun collaboration with one of the Dakota members here, artist, Cole Red Horse Taylor. And he created some art. And the theme of the art was Protect Your Elders. And so he created a drawing, and it was actually on ledger paper, which is a typical thing that sometimes Indigenous people create their art on. And so it showed a person in the community, and I think it had a baby, a parent and a baby, and then it said protect your elders, and then they shared that within their community. So we collaborated, we did some joint clinics, and then we just talked about, at times, vaccination isn't necessarily the way that the Dakota people might have preferred to respond, but the priority to protect the elders was top of mind for them.
That resonated.
Yeah.
Right? And Julie, what have you learned from this idea, the importance of having trusted messengers?
Yeah, absolutely. I think that we all learned kind of what you're saying during the pandemic, that community is a part of our mental health, right? And so I just wanted to comment on that. But yeah, I think we did build a lot of trust in the community. Kind of mentioned that we went out into the community to provide vaccines for kind of those essential workers who were really on the front lines and had the biggest risk. I just want to give a shout out to all of our volunteers. There wasn't a lot of money right at the beginning of the COVID pandemic for public health or the medical center to mobilize people to go out to individual people's homes or the farms. But we partnered with them to get these lists, and then we mobilized our volunteers to go out and, like I said, put on their boots to go to the hog farms and the meat packing plants and things. And I think we really learned during that time too that we can't just ask people to come into our clinic, that we need to go out into the community. So I think that was a big learning area from the pandemic too. And we really have increased our work in the schools in both the areas of mental health and also dental care. And in just this last year, we actually purchased a big mobile dental van that we're going to be bringing out into the community and kind of forming those relationships and creating that trust by acknowledging even that transportation can be such a barrier in our rural communities and making it easier for people to get care.
So it sounds like as a result of some of the conversations that you all were initiating with various community members about COVID and vaccination and just healthcare, you learned some other things that you've been able to tackle and work on it. And I have in my notes too, like multiple things have changed, including, a mural that was created by a Native artist. And can you tell me about that?
Absolutely, yeah, and that was started before the pandemic, but just barely, and then we kept it going through the pandemic. That's the Honoring Dakota project, and so again, it was sort of a springboard from a City of Red Wing collaboration that had started with the Prairie Island community regarding kind of restoring the bluff. And then one of the things that we talked about was related to historical trauma, and that one of the social determinants of health is that experience of trauma or historical trauma, and that there were many of our Dakota neighbors who'd experienced a lot of historical trauma, whether it was related to the boarding schools or the poverty they experienced or the racism that they'd experienced in the community. And so we also talked about at that time that you could look around the city of Red Wing and not know that the Prairie Island Indian community is right here. There isn't a lot of representation of the Prairie Island community.
Visually, you would not
Visually,
know.
right. And the city of Red Wing is named after Chief Red Wing. And so there was a group that really thought we got to do something about that. And so we had a collaboration that was between the city of Red Wing, Goodhue County Health and Human Services, Red Wing Arts, Prairie Island Community, and then lots of volunteers. We had multiple events that culminated on Indigenous Peoples Day in 2023 was the celebration of that mural that was created with input from the Dakota people on what did home mean to them and what was representative of Dakota values.
So if we fast forward to today and talk about the current environment, the Trump administration, we know, is cutting money that funds equity research, including health research. In fact, we had a very hard time getting people who study healthcare disparities to actually talk to us, to be a part of this conversation as we research the show. And it is understandable because the environment right now, it really is very, chaotic, and some would even, call it scary. So it's been difficult sometimes for us to get people to do interviews with us. But I want to hear from both of you in your work in public health and trying to help people take care of themselves. You've been impacted. I mean, have you lost some of your funding? Chris?
Yes, we just found out that we lost some funding that had come from the federal government and that the Minnesota Department of Health had. It got a notification that we had to stop spending that funding immediately. And so our allocation was, a piece of our allocation was passed through to the care clinic to pay for community health workers. So I literally had to call Julie and say, we knew we had this interview coming up. I literally had to call Julie and say, well, the funding that you thought you had for another year is over as of today. You need to submit your last invoice, and I don't know what you're going to do about that funding loss.
And Julie, how would you describe the impact of losing funding and not necessarily having a lot of time to do anything about it?
Right. Yeah. I mean, it's significant. It was for community health workers, which we found during the pandemic was so valuable, as we've kind of talked about all those reasons why.
Meaning hiring people to do this work.
Yes, mm-hmm. To do this work, to be kind of that bridge between the community and the clinic, and now they're fully incorporated into the clinic, and it's going to be really challenging to try to figure out what are our next steps to be able to keep them. We really value them and we want to keep them.
So people are finding out that they're losing their jobs.
Well, not yet. I mean, this is all really new. Mm-hmm. So I think we will need to keep them, but we'll need to find a way to replace that funding. And unfortunately, philanthropy is just not going to be able to keep up with the cuts from, government funding. There's just not enough philanthropy out there with the major cuts that are happening. And we additionally found out we had applied through Senator Smith and Senator Klobuchar's offices for some appropriations funding, and we actually got to the finish line. It was going to be over $1 million for a permanent home for Care Clinic. Right now we have in-kind space with Mayo Clinic. And because the continuing resolution was passed instead of the budget, our funding was not included in that. So it was very disappointing. We just recently found that out too.
So it's also distracting, right? Day to day, as you try to do your work, it's like this gloomy environment, right?
Yes. Right? I would say that it's just it's a fear. I mean, on the state level and the federal level, we know that the numbers are not adding up. We know that the enormous expense of healthcare keeps growing, right. And we know how desperately people need the care. And so we talk about it every single day. And then we get to the point where it's like, okay, we can't get ahead of this anymore right now. We just have to wait and see what's going to happen next and what's going to happen next. And trying to balance that with, we are going to serve our community. We're going to serve them one way or another. We're going to figure this out, and we don't know what this is going to look like, but we're going to have to be able to adjust on a possibly daily basis.
Because you all have just been talking about, you made progress, you learned things, you collaborated, you've developed trust, and so it definitely feels like a step back.
It's hard for me to say yes to that yet. I don't want it to be a step back, but
Right.
possibly.
Yeah.
Yeah.
Speaking of money, the proposed cuts to Medicaid, how would that work in terms of still trying to make healthcare accessible and affordable for all Minnesotans? We know that the Republican-led budget resolution calls for at least $880 billion in likely cuts to Medicaid over the next decade, and about $230 billion in likely cuts to SNAP, which is the Supplemental Nutrition Program, and that is bound to have some enormous ripple effects. So when you look at what could be happening with Medicaid, what are you seeing and what are some of your concerns there, Julie?
Yeah, it would be really devastating for Care Clinic, especially for our dental program. Already, because we see uninsured patients, and then people on public assistance, we have to fundraise 40% of our budget for dental. So if that 60% that we're getting from dental insurance reimbursements was cut, it would really be hard for us to continue. And I think just in a larger sense for rural hospitals and clinics, if that Medicaid funding is cut, it's going to be really hard for them to stay open, and that will have a big effect on the whole community.
Proposed cuts to Medicaid, what could be the impact for Goodhue County, Chris?
We're thinking about that every day. The concern is, what would those cuts look like, and who's going to make the decisions about what gets cut? Already, the Medicaid reimbursement rate is relatively low, and it's tough on providers to make ends meet with the Medicaid reimbursement as it is. And so, we're our mental health providers, our clinics. We have mental health providers that are the designated mental health agency for the county, and they have chosen to serve Medicaid clients. If they lose even more reimbursement, it's going to be extraordinarily difficult for them to stay above water. And if people don't get mental health care, or physical health care, lives can be lost. Absolutely.
A few years ago, Mayo Clinic started doing surveys in cities where it has hospitals to see where gaps in community members, what gaps that they saw in healthcare. And the most recent assessment for Goodhue County came out in 2022. The number one need identified was for mental health care.
Yes.
And so already not in a great position and seeing it worsen. It's just difficult to think about. We've had many conversations on my talk show about the youth mental health crisis, right. But so many young people are watching what's happening to the adults in their lives. And so, how do you compensate for that? Like, how do you begin to address that gap? That's something you're thinking about. I'm guessing, Julie.
Yeah, When we started 15 years ago, we wanted to start small. We knew there were so many different healthcare needs, but we wanted to start small with medical care and providing free medications for our patients and kind of being a resource hub. But then we wanted to grow as needs presented. And of course, mental health was the first area. So only a few months into being open, we recruited some psychologists who were volunteers to help with our patients. But then soon it was apparent that a lot of our patients were Spanish speaking, limited English proficiency, and it's just not therapeutic to work through an interpreter always. So that was one of the first things we added was hiring bilingual therapists to come from the cities. And we doubled the size of that program during the pandemic just because there was such a need. I know one of our therapists was just telling me that they do a lot of work in the schools now too. And there was recently a 10-year-old boy who the school called and said, this little boy has a plan to end his life, and we just really need your help, from our therapist in that intervention. So, there's just a lot of kids and adults that are really struggling right now, and it's just so crucial that we're providing the care that they need.
And so when, we were talking about the language barriers, if you don't have a Spanish-speaking therapist, then you need a third person to be part of that very intimate conversation, making it less likely that someone would actually open up and talk. A second priority that was identified in that assessment was help with substance abuse. I've done lots of talk shows about addiction and people in recovery and people relapsing. So I know a lot of people care about that topic a lot, but what are you seeing, or what are some of your concerns about getting help for people who are dealing with addiction?
Well, just the worry about there being fewer substance use providers, being able to get to substance use treatment. Then also, the stigma connected with that. Just the challenges overall with seeking treatment and being able to follow it through to the end, having the community support, and then the idea again. It's more than 30 days in treatment. The true substance use treatment is the primary treatment, and then the follow-up care, and then the wraparound services around that. And it's a whole model that sometimes includes housing. And we know some of the elements that when they're in place, it's more effective. But those wraparound elements sometimes are the first to go, the ongoing, case management or places to live, sober housing, that kind of thing. Those are hard things to get. And if we don't have that, then we have people who are, losing jobs. They're not able to pay taxes. They're not able to care for their kids. They're extraordinarily ill in a number of ways. They're requiring medical care. It's also more expensive. So, I don't want to overlook, like, there's the human toll that's, unmeasurable. This is also just not a wise thing to do. You can pay for preventative care and early intervention. You can pay for sealants for kids, or you can pay for abscesses and root canals later. But people need health care, and the smart money to pay is the prevention and early intervention. The things that tend to get cut when budgets get cut are the prevention and early intervention services. And not only is that just not good for people, it's not a good investment of money. You end up paying deeper end stuff, and we've seen this cycle happen. The money comes, the budget cycles, the trends go up and down. We're going to see higher spending on crises, and then people are going to say, oh no, what should we do? And we're going to say, you should do prevention and early intervention. And then the funding comes back around. I mean, I've seen it happen. And so we're going to have to ride this out. But part of what we want to be able to talk about is, even though there's spending right now, it's very short-sighted to eliminate that prevention and early intervention. It would be incredibly poor decisions if we lost funding for basic dental care, especially for children, but for anybody. Basic dental care is a drop in the bucket compared to serious dental care later. So I'm hoping that we can hold on to those concepts of the prevention and early intervention.
And what are you seeing with substance abuse and the needs there, and how whole families are affected by it?
Yeah. Fortunately, we have, well, unfortunately, because it needed to be provided, but we got some opioid settlement money in our community recently. And so there is kind of a big effort right now, and Care Clinic was a recipient of a grant to kind of really continue to work on this. But yeah, I kind of, what Chris said, it's holistic. I remember one of our first dental patients that we had came in for extractions, and she pulled me aside and she said, I just want to thank you for providing this extraction for me. She said, it's so beyond the dental care that you're providing. She said, I was addicted to meth and it wrecked my teeth, and now I've been in pain. I've been sober for 2 years, but it's really hard because I'm in pain all the time. And so she said, this is providing not only the dental care that I need, but it is providing for my sobriety. It's providing for me being a mom for my kids, and not having them being taken away. And so I think just that, looking at that overall holistic look at health and how each one of these areas is so important for even substance abuse care.
Well, and I'll even add to that another avenue towards addiction can be ongoing dental issues that aren't treated. And when you can't get dental care early, you eventually end up with abscesses and emergency care, and you go to the emergency room. What can they do for you in the emergency room but give you pain medicine, which has in the past included opioids? So there is a percentage of people who are addicted to opioids because of the dental issues that they've had. I mean, it's not the top cause, but it's part of it.
This sounds like a whole other talk show, like dental care. I mean, really, like I'm learning. As I look out the coffee shop tonight here in Red Wing, full of people. Clearly people here tonight who all care deeply about this topic. Kristin, Julie, clearly this is your village. But I would love to hear you sort of speak to this idea that this is not a problem that just health professionals need to solve. That this is something that all of us need to somehow contribute to and to reach some type of solution, because we're all affected by our fellow community members' health. And what do you say to that when people, if you think about it, this is just not a healthcare professional issue?
Yeah, absolutely. I mean, Care Clinic has taken so many community members to make happen. I mean, it's truly been a grassroots effort. And out in the audience here are some of those original people who went on that trip to Biloxi and had the idea of Care Clinic, as well as some of our major funders. And we're just so grateful for everyone who has made the Care Clinic happen. And it's really a testament to the whole community. There's policy changes that can happen on the local, state, and federal level, but sometimes those take a long time to come to fruition. And so what our community decided is we're going to support Care Clinic, and we're going to seek out those gaps in care, and we're going to collectively provide it together while we're working on the policy changes. And so I'm so grateful for our community, both in Red Wing and then our larger community of foundations and things that have supported us all around the state.
And Chris, your thoughts that this is not just a health professionals issue, it's a community issue.
Oh, absolutely. And I think that our community is extraordinarily caring. I mean, this is just a small piece of the people who are out there and caring. And to me, I just think, first of all, we're so grateful to our compassionate community. And I think also just let's not panic and let's not give up. Let's keep going. Let's keep caring about our community. Let's not back down. And we're going to have to get creative. I also really choose to believe that these cycles come and go, and we're going to come out on the other side of this. We're going to keep talking about how healthcare matters and supporting people matters, and the well-being of the community matters. And so the more that we keep investing in our community, even through this rocky time, I think there are some people that are feeling so discouraged and hopeless that they just sort of tune it out. And it's like, no, this is the time to get active and feisty, and we can do that. And I feel like we'll get through this dip, and we'll come out on the other side and be okay.
I agree with you. It's a call to action.
Yes.
Right.
Yeah.
And with that, I would love to hear some of the stories from our audience members. If you would like to share something that you've witnessed that has inspired you, or something that concerns you as we talk about healthcare and healthcare disparities, if you would like to share it with the folks in the room, share with our listening audience, we can do that right now. My colleague has a microphone, and she's happy if you raise your hand, she'll come to you and you can share a comment or ask a question. We would love to invite you to be part of the conversation. Anybody willing to go first with that? I know you've been drinking coffee. You've got energy. Anybody? No. Going once? Twice?
Should I call on people?
Oh, yeah. Okay. Yeah. See what you made me do? Yeah. Julie, names. Calling someone. No, really. I mean, if you think about, tens of thousands of people across the state are listening, or will be listening on the radio, what would you want them to know about what's happening in Red Wing, or what you personally, really care about as it comes to 5 years later? Are we moving in the right direction with healthcare? Okay, we got one. Oh, she raised her eyebrows. She raised her eyebrows and pointed. Okay, and if you would just say your first name, I would appreciate that.
I'm Connie, and I volunteer at the Care Clinic every Tuesday. I'll just tell a story about something that happened yesterday. A gentleman came. He needed insulin, and our site has been designated as one of, I think it's 10 sites in the state where we have a supply of insulin for an emergency use. And this man was just like, I didn't know what I was going to do without that insulin. And this happens because in our state, not just Goodhue County, in our state, we're carrying people who worked to get the drug companies to agree to provide some of this. And we just are lucky to be one of the agencies that can join hands with that and make a huge difference to people who are dependent on insulin.
Thank you, Connie, a volunteer there at Care Clinic.
And can I just say, Connie has been our prescription advocate for 15 years. And each year, it's usually about $500,000 of free medications that she is able to acquire for our patients.
Mm-hmm. Thank you, Connie. Anybody else want to share a story of anything that they've witnessed, been encouraged by? Yes, we have one. Oh, we have one there in the back. She's trying to get to you. Thank you. You tell me your first name?
Yeah, name's Eric.
Mm-hmm.
So first, I just want to thank Chris and Julie and NPR, Angela, for you coming to Red Wing, because I think sometimes we get forgotten about in southern Minnesota, so I appreciate that. And I appreciate the talk about whole person care, because we see in the mental health world, people come to us and to your clinics and to the county daily who might be complaining about physical ailments, but it's about their depression or their anxiety, and maybe it's about uncontrolled diabetes or high blood pressure too. So there's a definite connection. I think we also see we're unique in a very special way. We all love working and living in rural communities, but there are some challenges with that. People that live in rural communities, disproportionately high rates of suicide. Our farmers are more stressed than most people that run their own business. So there's some challenges we have, but I think what we learned, and a lot of us during the pandemic, which has been shared, is we're connected better to the people that receive services from our healthcare system because we asked them questions more during the pandemic. Mm-hmm. The other thing is telehealth became a big, big thing very quickly. And so we've learned, I think, in most of our healthcare settings is that that it's a good way to provide the service still, but not for all of them, not for everyone. And so we just hope that some of those loosening restrictions around telemedicine continue in the future, because it's been very effective at reaching people that we otherwise maybe wouldn't have. Mm-hmm. And we've learned some things from that. So thank you.
Thank you. Thank you, Eric. Yes, I had forgotten about telehealth. That was such a mind-blowing thing to do, but it continues on. And that is something good we can look at 5 years later. Anybody else? Yes, sir. Is that Mr. Mayor?
Yes. My name is Gary, and I have the pleasure of volunteering at the clinic once in a while. Oh. And when people come in, there was one story where someone brought someone else in for their care. And, the staff starts talking to the person that brought the person in, and they find out that this person, just the transporter per se, has issues. And, it's not just one person. And the clinic has a staff that is unbelievable. And no one has ever turned away. Doesn't matter if you can pay or not. I know I'm going to get yelled at because we're not a free clinic. But if you can't pay, and the dental aspect is huge. We're looking at adding a full-time dentist. We have a complete staff. We have 3 hygienists and a advanced dental therapist, which is kind of like a PA in the medical world. So the Care Clinic is doing an outstanding job serving our community and other communities around. And we go out to schools now with the big dental van and treat kids that, as we know, in this socioeconomic range, transportation is a huge issue. So we are taking the van out to the folks to help them get dental care. And Julie does a phenomenal job.
So does Mayor Yako. He's our former chair and has helped us expand our dental clinic. He comes from the dental world, so it's been so instrumental.
Yeah. Any other question? Thank you, Mayor. Another question from the audience?
My name is Dan. I don't have a question, but I was the original medical director for the Care Clinic, and probably the only reason I became medical director is Julie's really good at twisting arms. I was
Okay, Julie.
I was one of those skeptics initially because having practiced medicine, I used to see a lot of patients who were on medical assistance, and I knew that our emergency room was always available to whoever needed it and could not be turned away. So I just didn't understand, what that great need was. But it was that story that Julie told about the single father who died that helped convince me that there really was something to this. So I also would like to take my hat off to Julie for all that she's done, because I don't think I'd be here if it weren't for her.
Thank you, Dan. Well, I want to close by Julie asking you the same question I asked Chris at the very beginning of the conversation. Given all that we have talked about here, do you think healthcare access to it is getting better for everyone?
Yeah, I'm going to try to take a positive spin on this. I think there has been some really great strides made. The expansion of Medicaid in our state and more recently Minnesota Care. Of course, now those are at risk. And so I think we need to do everything that we can to protect those advances. I think that, the workforce, we haven't really talked about that very much, but having a healthcare workforce in our rural communities is really a challenge. I know that the state of Minnesota is starting another medical school that's focused on rural in St. Cloud. I think that will be really great in making sure that we have doctors for rural Minnesota. And there is also one in Duluth. My husband, actually, who's here, attended that medical school, and my son is a first-year student, and they do a really good job of recruiting. I remember my husband, one of his questions for med school interview was, have you ever ridden a tractor? He hadn't prepared for that question, but just wanting to make sure that they're recruiting people who are really interested and understand the culture of rural Minnesota. And then as Gary mentioned too, I think our state is innovative in having an advanced dental therapy program. That program is focused on providing access to dental care that's affordable for rural Minnesota. And then even at Care Clinic, we have gotten a grant from the state. It's kind of a dual training pipeline grant through the Office of Higher Education and the Department of Labor, where we can provide tuition support for people to go to school in dental and medical fields. And so we've actually recruited some of our patients to go to school to become nurses and dental hygienists and dental assistants, as well as working with the high school to kind of create that pipeline. So I think those are all really positive ways. I think one of the big lessons learned in the pandemic is we need to have a healthcare workforce that reflects the patients that we're serving. And so through that program, we've really been able to work on having a more diverse workforce that has the linguistic and the cultural knowledge that we need to serve our patients really well.
Well, Julie and Chris, I just want to say just how grateful I am that you all are out here working on really behalf of all Minnesotans. And so just want to express my gratitude for the work that you're doing. And I know that the problems right now can seem very daunting, but I love your optimism. And I can see that you are true helpers, as Mr. Rogers would say. And again, if you've missed their names across the conversation, I've been talking to Julie Malyon, the Executive Director of Care Clinic here in Red Wing, Minnesota, and Kristin Johnson, the Deputy Director of Health and Human Services for Goodhue County. We are, again, so grateful for all the people who contributed to this production, to our audience who came out tonight. Thank you. And I just want to say thanks to our technical crew from NPR News that travels around the state as we have these conversations, and the staff and the owners of Mandy's Coffee and Cafe here in Red Wing. Come visit them the next time that you are here in Red Wing. We will be back with another North Star Journey Live conversation soon. Until then, be well, everyone. Thank you.